You have died of dysentery. Again? Well, at least I didn't drown my whole family in horse this time. What is dysentery anyway? So chances are, if you were a kid anytime from the 1970s to the 2000s, you've heard of dysentery from the popular computer game Oregon Trail. Dysentery is a nasty disease that causes severe stomach cramps and diarrhea. It's not just any old stomach virus, though. With dysentery, your stool may have blood and mucus in it. Gross. And just like any diarrhea disease, it can be fatal if you don't stay hydrated, which was really difficult on the Oregon Trail. What a terrible way to go. But in today's developed world, it's a lot more mild. Most people don't even seek treatment. That's right, you might have had dysentery without ever knowing it. But this isn't a video on dysentery, it's a video on the cause of dysentery. And dysentery is often caused by a bacterium, not a virus, called Shigella. So, grab your strongest stomach and a bottle of Gatorade. You're going to learn all you never wanted to know about Shigella. The pathogen. Shigella is a type of bacteria, and it comes in 4 different strains. One of these is Shigella dysenteriae, the type that can cause dysentery. It's pretty rare in the United States now that we aren't traveling in covered wagons and have more sanitary conditions. This is also the deadliest Shigella. So there's also Shigella boydii, and that's also rare in the United States. The most common type here is Shigella sonii, and the 4th type is called Shigella flexneri. If you're infected with any of these types of Shigella, you have shigellosis. But we'll talk more about that later. Shigella looks like small rods that appear as singles, pairs, or in chains. And it doesn't have a flagella, and they are anaerobic. Once it's in your body, Shigella crosses the epithelium of your intestines. And once it's there, it attacks the phagocytes. These are the cells in your body that basically eat bacteria. You know, Pac-Man style cells. Anyway, in a 1992 study published in the journal Nature, there were 4 tested strains of Shigella flexneri, and they were tested for their ability to cause cell death. One invasive strain called apoptosis, or programmed cell death, while the other 3 strains were non-toxic. But all the strains can cause intestinal abscesses from the attacking phagocytes. So toxic or not, Shigella is a nasty bacterium. Transmission. So how do you contract a nasty bacterial infection? Shigella is contracted through contact with fecal matter of an infected person. I know what you're thinking. No one just touches other people's poop, right? But it's more common than you might think to come in contact with someone's fecal matter. So imagine you're in a public bathroom at a restaurant. You do your business and you wash your hands well. And someone else comes out of the stall and barely rinses their hands before leaving. Ew, you think to yourself, but you're doing the right thing, clean hands. Not so fast. You just touch the same door handle as that person who barely washed their hands. Then you go, you sit back down at your table, and you're feeling good about your clean hands, and you take a huge bite of your burger. Congratulations, you just ate Shigella. Or what if someone doesn't do a great job of washing and prepared your food? Or maybe even a child leaves bacteria all over surfaces in your house. Fecal matter can also be present in water and transmitted in all types of sex. Thankfully, our bodies fight off lots of bacteria and viruses every day, so it's not like you have to live in a sanitary bubble. But unfortunately, during westward expansion, the pioneers weren't exactly swimming in Germ-X. They had to do their business outside or in a chamber pot, and were often left without a way to wash their hands. Plus, germ theory wasn't really common knowledge, so death by dysentery was actually pretty common back then. Signs and symptoms. The incubation period for Shigella is about 24 to 48 hours, and that means you'll start seeing symptoms about that time. At first, you may notice some mild stomach cramping, and then the diarrhea will start. Both the cramps and diarrhea can range from mild to severe. And like I mentioned at the beginning, if it's more severe, you may actually see blood or mucus in your feces. You may continue to feel like you have the urge to pass feces, even when there's nothing left. And you'll probably run a fever as your immune system tries to fight back. Shigellosis usually lasts about 5 to 7 days. As long as you stay hydrated, you'll probably feel pretty normal soon after that. but sometimes it can take months for people's bowel habits to regulate again. In rare cases, people can become lactose intolerant for several years after infection. You know, not being able to eat cheese might actually be worse than the infection itself. Diagnosis and treatment. Usually, doctors will treat gastrointestinal diseases the same way. They'll say, stay hydrated. If you can't hold down water, you might actually end up at the hospital to get IV fluids, though. If you have a more severe case, your doctor may decide to run some lab tests to see exactly what your infection is. And because Shigella is a bacteria, antibiotics will actually help treat it. Your doctor will find out what strain you have and know which type of antibiotics will work the best. Another drug called Flagyl is often prescribed for dysentery. It treats parasites as well as bacteria. Prevention. There's no way to 100% avoid Shigella, but if you wash your hands and you use sanitary practices in the kitchen, you're going to decrease your risk. Avoid swallowing water in lakes and ponds when you swim, and if your partner has had diarrhea recently, practice safe sex or avoid it altogether for a couple of weeks. Shigella is both rare and more mild in the United States. Your greatest risk comes from visiting third world countries. But if you're proactive in treatment, you should not meet the same fate as my character on the Oregon Trail.